This is Dr. Gill from Pulsar Health, and today we have an acupuncture physician with us, Dr. Christy Bongiovanni.
Oh, that's me. Hello.
So it's going to be a fun time. The two of us are going to talk about acupuncture, including cosmetic acupuncture, which I think many people have not even heard of. A lot of people don't know about that.
I'm sorry, what was that?
You find that a lot of people don't know about cosmetic acupuncture?
It's definitely a conversation that, yes, a lot of people aren't aware that acupuncture can be used for cosmetic purposes. So that's a cool conversation to have with patients and potential.
Great. And conveniently enough, today I have a headache and my neck hurts and I feel a little
no.
So Christy is going to help me by telling me what points to press on and how we can start to fix that. And you guys can like join along if you want to too, if you've got any kind of like headache or anything. And so it's going to be very interactive. Please feel free to ask questions in the chat box. Everyone can get to the chat box in the webinar or on the IG live, and we can get those questions answered by Christy or myself. Christy, how did you get into acupuncture first of all?
So I had started I went to the Institute for Integrative Nutrition, which is an online program where you study a lot of dietary theories, over 100 different dietary theories, and one of them was Chinese medicine and food therapy, and I fell in love with it. And the reason why I thought that it was a path that I had wanted to take was because I was tired of watching the people in my family just popping pills for pain and high blood pressure, high cholesterol, you name it. I knew someone that was taking some sort of medication for it. And while I do think that conventional medicine is an amazing tool, I think that there are so many other ways that you could keep yourself healthy without having to take pills, like food therapy, nutrition, all of those, just like supplementing with additional vitamins, because the food that we have in our society right now is so nutrient depleted. So you do need to supplement a lot of the times. So watching my family go through some of the health illnesses that they went through just really pushed me towards acupuncture and Chinese medicine. And through that, I found a whole world opened up to me, and it's been an amazing ride. It's so much fun to really help people. I'm just the catalyst for people's bodies to do what they're intended to do. So we're supposed to be healthy. We're supposed to be able to fight illnesses on our own.
And I got interested in it. I have a personal story because when I was in residency in Pittsburgh doing general surgery, I was working really crazy hours, and my thyroid gland went out of whack. It was hyperactive, and the only treatment for it was ablation or pills. And I took the pills, and it controlled it. But I was like, there has to be another way to treat this that doesn't involve killing the gland, that doesn't involve getting rid of it. And so I acupuncture at that time. That was the first time I ever did acupuncture, because I was like, and I've always been kind of interested in it. Back in med school, I wanted to do it. I wanted to go to China for 3 months. They had a program, and my parents said no. I was like, oh, bummer, because they were paying for it. So I never got to go, but I did try this acupuncture when I got sick in residency, and this might be too much information, but my periods had stopped for 3 months with
wow.
going on. And usually when you start the pills, it takes about a year for your periods to come back when you've been that hyperthyroid as I was. In 3 weeks of the acupuncture treatment, they came back. So I was like, whoa, something works here. This is real. So
that's phenomenal.
Yeah, so it's a modality that made me realize that Western and Eastern can work together, and they're both important, because had I not had the pills, that my heart would have been out of control and I could have had a stroke or whatever. So the Western was essential, but then the acupuncture get to the root of the problem and starts really dealing with things. So it's a
beautiful complement, like, to each other.
Exactly. So with acupuncture, like, how do you know, like, what to treat? Like, what kind of things should people come in for if they have a problem? What kind of things would it be helpful?
So I could go on and on talking about how acupuncture could help with all sorts of things, but I'll tell you the majority of the patients that I see come to me for, other than the cosmetic acupuncture, which we'll get to, but chronic pain. I see a lot of patients with thyroid conditions, autoimmune disorders, sciatica, tennis elbow, golfer's elbow, all of those pain, acute and chronic conditions. I see a lot of people that are struggling with digestive health, whether it be constipation, IBS, gastric reflux, all of those. I see a lot of patients for allergies, because in Florida we have a lot of those.
There's a lot of pollen, yeah.
So, yeah.
So okay, so if I have like, are there like the best way to have a treatment is obviously to come in and have like your full body done,
Yeah.
or certain points, but what are there, I know people sometimes wear these bands or something when they get seasick, like what would you recommend for my 3 complaints today?
Yeah, so you have a headache going on, right? There's a headache, some neck and shoulder pain. So what I would recommend is there's a point right in the middle of between your thumb and your pointer finger, right over here, if you can see that.
Does it matter which hand you use?
It doesn't. It
Okay.
does not matter.
Okay. So
you would want to, you're going to want to press here, really massage that point in there.
okay.
So this is a major point for headaches. It's a really nice acupressure point that you can do at home. And then there's also right behind your neck, like you'll feel
I just want to say I'm feeling better already.
Are you?
A little bit. It's still there, but it eased it immediately. Like it's strange.
It's wonderful. That's so cool. I love to hear that.
I'm trying the other hand now.
Yeah, try. Do them both. Really get in there with your massaging.
The other hand is not quite working as well. I don't know whether it matters because the headache is mainly left-sided and I'm using my left hand. It shouldn't matter though.
Everyone's so different. Everyone's body is different. Sometimes I won't needle bilaterally. After an assessment, we'll kind of figure it out. And then I may do this point. It's called large intestine 4, the one that you're putting pressure on now. And then I might go to the other side of your body and do liver 3, which is between the big toe and the second toe. It's kind of the same area, just on your foot. So those work nicely together, and it's a nice balance.
Okay. And then you were saying this one back here?
Yeah, right back in the back of your head, like by the occiput. You're gonna feel you'll have to feel around because it's hard since I'm not there with you. And then you'll just do like a little massage that may help ease up that tension. And then by your shoulders,
like a circular massage.
Yeah, just to apply some pressure, make it feel good too. You don't want to just like poke yourself. Do a nice little massage.
Cool. And then would you like recommend any oils or anything else to help, or any? Actually,
I do. If you have peppermint essential oil, I think that would be great, and you can massage that into your neck or even into that large intestine 4 point right over here, and then that could definitely benefit you.
Yeah, peppermint helps with nausea too, doesn't it?
It definitely does.
What would you also recommend for nausea? Was there a point on the wrist or something?
Yeah, so like you had said with those bands, there's a point, it's called pericardium 6. So it's about a finger's length on your wrist right here, kind of where that, and you just want to massage in there. The band goes a little higher. That's you can massage there too. It's kind of wherever you're most sensitive.
So you kind of feel where it feels right on you, and you go.
Exactly. That's like the easy at-home treatment. So you have that would be your pericardium channel.
Okay, cool. So, so when somebody comes in for an acupuncture treatment, like how do you obviously take their history as an acupuncture physician, and you sort of pick one thing to work on at a time, and then you work on the others sort of a little at a time, or how do you go about it?
So the beautiful thing about acupuncture and Chinese medicine overall is I don't have to pick one specific thing to work on. I'm essentially, the idea is to create a homeostasis, so a nice balance in the body. And I could work on a couple different things. If you are coming to me with a full list of conditions, we may pick the the most severe one first, especially if it's pain. So we want to get you out of pain. And then I may add some points to help with the other conditions, but we may focus on them a little bit later, since our primary concern would be to get you feeling better and out of pain. Because when you're in pain, your body, your mind, we know everyone's had some pain in their lives.
It's very draining. Yeah, it's hard to be performing well.
You can't sleep.
Yeah.
If you're not sleeping, you're not healing.
Yeah, exactly. So, so with the pain stuff, do you, like suppose your joint hurts, do you give them a treatment with the needles and then give them something like to rub when they go home, or like how often should they get acupuncture treatment? How does it work for something?
So I will definitely give patients what I like to call homework. So they're going home with, whether it be herbal supplements or topical ointments to put on. I do like to utilize CBD. I know that's very trendy now, but I find it to be a really powerful tool in my toolbox.
Actually,
so
one of my Uber drivers, sorry to interrupt.
No, that's okay.
He used to be a truck driver, and he had to stop working because he had so much back pain, and he was on opiates for like 5 years, and then he started using CBD oil, and it cured his need for opiates, and he just used CBD and is now back to driving Uber instead of like trucks. But
wow,
it changed lives. Like the topical CBD is like makes a big difference.
It's huge. It's huge. So that would definitely be something, if you are dealing with like a chronic pain like that, I'm going to want to send you home with maybe a CBD or another type of herbal ointment, something like that. I do utilize Chinese herbs a lot in practice. So a lot of that is going to be customized.
Do you have any with you that you recommend, like herbs and things to help people, or supplements? Do you have any lying around?
So I do, actually. So I have a couple, like I have my little like a first aid herbal kit here next to me, but I'll show you. I picked out
yeah, that's so helpful for people that they can get this first aid kit, you know?
Yes. And it would be customized like for specifically what's going on right now is what I have next to me. So with all the COVID-19 cases. So this one, I don't know if you can see it, but it's
just a little bit further back.
You got it?
Booster shot, urban herbs.
Yep. So a good friend of mine actually owns the company, and she customized these formulas for the booster shot, as you would imagine, it's a booster shot for your immune health. Then we have the flu fighters.
What kind of herbs does the booster shot have in it?
Oh, let me read them. They're kind of small, but they're all immune boosting herbs, and they're all in Chinese. So I don't know if anyone would recognize them, but we have some Baiju in here, some Fang Feng, Quan Qi, Ren Shen. So they wouldn't really make sense.
Mandarin, I don't know what that's in.
Yeah.
Okay.
So we have, and then I have the flu fighter, and I have sick day, and these would be depending on what your presentation of illness would be. So they're for different stages. The booster shot, if you're someone that's still working right now, one of the essential employees, and now that everyone's coming back to work, I would say go to urbanherbs.com and get yourself some booster shot. You could also get it through me if that's easier. I have some in stock still. And so those are like the Chinese herbal formulas that I have on hand right now that I found to be really helpful during this situation.
Great, thank you.
And then so other herbs and everything that I would do for other cases, it would be customized based on the patient's individual need, which is what I think is so cool about utilizing herbs and acupuncture in general. Like, it may look sometimes like I'm doing the same treatment, but I'm really not. Like, it's every day you're presenting a different situation. So we'll tweak some things, and then you may be on the same herbal formula for 2 weeks, and then we have to tweak that as well as your body's adjusting and healing. So that's cool.
How often should people be going in for treatments? I know it's different when it's sort of maintenance versus when it's
exactly. Yeah. So I would recommend, again, you're gonna get tired of hearing me say this, but it depends on what you're coming to me for. So in the beginning, I would say expect to see, we'll get real close. So expect to see me 3 times a week in the beginning, maybe the first 2 weeks. So 2 times a week for the first couple weeks is usually my go-to recommendation, just so I could see how you're responding to acupuncture. If we need to tweak something a little sooner, we will, and then we'll see from there, like what your needs are. So
yeah, I had one treatment with Christy, and it was for cosmetic acupuncture, but it was so relaxing. Like,
yes.
I get up afterwards. I was like, my face also looked very refreshed. Like it had a lot more blood flow.
Exactly.
I was surprised that it was so effective so fast. So how does the cosmetic acupuncture work?
Okay, so basically what I'm doing by inserting the needles into your face is it's creating like more blood flow, better circulation. It's then producing, like telling your body to stimulate the collagen and elastin production. So you are going to be a little flushed, and that's the blood flow glowing, but going. So that's basically how it works. And then it's going to then tighten the muscles over time, depending on how many treatments you're coming in. So strengthen, rather.
So how does it strengthen the muscles? Does it stimulate them like with the needles, or how does that work?
Yeah, so it's essentially trigger points. I don't know if you're familiar with trigger points. So
you might want to explain to our audience, yeah.
So trigger points, and well, I'll actually go the acupuncture route. So the acupuncture points are neurovascular nodes throughout your body. So they're just highly vascular, and your lymphatic system is going. There's a lot of energy production there, I would say. So your immune system. So basically by stimulating those points, we're directing the body to kind of do what it's supposed to do by freshening decreasing inflammation, producing stimulating the elastin and collagen production, stimulating the blood flow, getting the lymphatics going again. So that's how it works essentially. And then it'll tighten the muscles, because those are, again, like I said, like they're trigger points. So they're strong little areas that we're inserting into the muscles also on the face, those small muscles. And it's just kind of,
does it affect it if you have Botox or Dysport to relax the muscle? Like how would the cosmetic acupuncture affect that?
So we wouldn't do that on the same day, but it would be like a part of a plan. I find that it is helpful. You might want to wait like a week or two after doing the Dysport or Botox, and then to allow that to last a little bit longer, you can start with the acupuncture. So it doesn't decrease the effectiveness, it increases it. You're basically boosting the whole body, and acupuncture has anti-aging factors to it, so it just really, it helps overall. I don't know, it's so simple, but
yeah, no, it totally made an instant difference. So with the are there any herbs or any other supplements for the cosmetic side of things, or is it mainly having the treatments?
We can definitely do some herbs internally, but again, they would be customized based on what's going on, because a lot of people may have, I do treat some teens, and they have a lot of acne. So we're going to address what's going on inside also. And then we'll do some, we might have to switch out whatever facial regimen you're on. So we'll have you doing, maybe the soap that you're using isn't working, so we'll switch that out. And we have some products for that, but it's based on what you're presenting to me.
Mm-hmm. So, how long does the effect last? We got the instant glow, but how long does the effect last, and does it build on itself? How does
it definitely builds on itself? So you want to come in again. Acupuncture in general is going to build on itself. So if you have one treatment, you might instantly see the glow like you did, but it does fade. So you want to be more consistent with it. So I would say, again, 3 to 2 times a week, and then we'll go from there. It really depends on how, what you're looking to accomplish, and how what your presentation is. It's as simple as that, because it's customized for you. And then so it could last months to years essentially with maintenance. So I just want to be clear with that. Once we get the initial result that we're looking for, over time it will get better. And then if you maintain twice a month to maybe even one time a month for the cosmetic acupuncture, you'll be in pretty good shape. And then if there's other fun stuff that we want to do too, I know that you offer at Pulsar, we can add that into the regimen.
Yeah, for example, for tightening the face, we have the Vivace, and that's great for resurfacing the skin. It helps with texture, with pigment, and tightness. It has radio frequency.
Mm-hmm.
But it really works on the skin and not the muscles. And so thing that works on the muscles is really helpful. I do recommend facial exercise, but a lot of times it's hard for people to be consistent on those.
Exactly.
So and a facelift is where we move the SMAS layer, which is the thicker layer of tissue underneath the skin, and we lift that as well as lift the skin. Some people do only like skin facelifts, but I do both, and because it has in my hands a better result and longer lasting.
Yeah.
But it doesn't work on the muscles. So the fact that you do something that works on the muscles is so exciting as a unique modality, because we don't really have much else that works on muscles. There's like an M Sculpt machine which works on abs, but you can't really see that because oftentimes anyway. People, and then sit-ups are a lot easier for people than facial exercises. So the fact that you're actually stimulating the muscles, improving the blood flow is really great, because it works at a deeper level than a lot of our current treatments are. Obviously, go ahead.
Okay, and just to add, like, were you to decide that a facelift is for you and you want to do that, like, I would also recommend like doing acupuncture as a part of the recovery, because it can help with the inflammation, get the healing process going a little faster. So that's just another way that they both integrate so nicely together, the Western and Eastern medicine.
The scar healing depends a lot on the degree of blood flow and the degree of inflammation. So being able to regulate and control those better is really helpful. It just is a great fit. I'm a plastic surgeon, so I'm excited about having that can work hand in hand with us, as well as help the overall health of the person, because at Pulsar, we're all about like beauty built on health. And so to have a healthy person with a healthy immune system, good healing, and then on top of that, be able to target specifically like cosmetic acupuncture is just so exciting.
Yeah, it is.
So I know that you have a practice in Jupiter, but you're also going to be working with us too, which is
I am, which I'm very excited about.
Yes, it's going to be fantastic. So are there any reason why people would not want to have acupuncture? Suppose they're afraid of needles. Like I have to give myself every time I have a blood test, because I'm like, so, but acupuncture don't bother me, which is weird.
Well, I can't tell you how often I hear that same sentiment. Like, yeah, I mean, acupuncture does utilize needles, so, but they're so thin, and I will tell you, I have been told, not to toot my own horn, but I have a gentle touch. Like, that's not to say that like you may not feel anything. Like, it's likely that it might pinch for a moment, not like a second. So, but know that the benefits are going to outweigh the pinch that you may feel.
Sometimes if it hits a certain point, you feel it radiating up and down, or it can get stronger and then fade away.
It's so interesting how that works. And that's, I mean, it's essentially like your body's immune system working, and it's the circulation going, it's the energy pathways going, it's your lymphatic system moving, because we're creating little like micro damage. It's similar to micro needling, like on the face.
It's strange because it's kind of setting nodal points. Like for example, in nerves, you have Schwann cells which wrap around a nerve and they leave little nodes. And the nerve fibers that have these Schwann cells around them, the signal moves a lot quicker because it jumps from node to node to node. And so that's a nervous system. So I'm just wondering whether, I don't know how acupuncture works, but I know it does. I just don't know how. But I'm wondering whether the places where you put the needles, they kind of like allow something to shift. You know, it's kind of strange. I don't know how it. Well, what is all this about chi and like? Can you
well, that's the thing. That's the thing too. Like chi is basically your body's vital energy, we call it. So I don't talk too much about that because people are wonder like, what is chi? Even when I was in school, as I'm learning about it, I was like, but what is it? You're telling me it's not energy, but it's not this, but it is this, and it is your energy. So it can get confusing, but it's an ancient Chinese theory, and I think it has to do with, from what I've read in my textbooks and what I've gathered, like it's everything. It's oxygen, it's blood flow, it's your lymphatic system. It is this energy this esoteric energy as well. Like it's kind of it's our life force. I hope that helps a little bit, but I know that there's an aspect to it that even I still don't understand how it works, but I understand more than the average person because I've studied it for so long.
It's like,
but there's a spiritual aspect to it as well.
Yeah, it's like electricity when you know the little electrons are flowing down the wire, but you don't necessarily understand
exactly
where did that electron come from. Did it come from the metal, the cathode anodes and stuff? You're like, I don't get it, but I know it works.
Exactly.
And so yeah, I'm not even going to try to figure out how a car combustion engine works. I know there's people out there.
Oh no, I'm not going there.
Yeah. So but yeah, so any downsides to acupuncture?
I'm thinking the only thing that I can think is like you may just feel tired or too relaxed, if you want to call it that. I mean,
it's strange how you go into this really relaxed zone during it, you know?
Yeah.
Minutes of starting the treatment. Yeah.
So, and that's going to vary too, depending on the treatment and on the individual. That's why I like to see you multiple times in a week to gauge how you're going to react. Because if you're coming to me for insomnia, well, then we may want to do that later on in the day rather than a morning appointment. However, if you're only available in the morning, we'll figure it out.
Yeah.
Like your body's going to adapt.
And then you have your herbs to help too. What about teas? Talk to me about Chinese teas, because I love tea. So
yeah, I love teas too. And to be honest with you, not so like there is one Chinese tea that I do love. It's called pu'er tea. I hope I'm not butchering that. And it really helps with digestion. How do
you spell?
P-U apostrophe R-E, I think. We can maybe send something out or I'll write a little thing on that and post it.
Okay.
So that's gonna help with digestion. I love teas too, though, like not just Chinese teas, like all different teas.
Do you think oolong tea is good for weight management, or is that
what kind of tea?
Oolong, Chinese oolong tea.
They say that it's helpful. I would probably add more. Well, I would definitely do a pu'er tea, and I'm going to get that spelling for you. I would add that right after your meals. You can do the oolong as well. So anything with like a warm temperature is going to help with the digestion process. So that would be good. Even peppermint tea is going to help with digestion because it relaxes your muscles and makes things a little easier to digest.
What about stress relief? Because this is a very stressful time for a lot of people.
It definitely is. So for stress relief teas, I would say get like a chamomile tea because that's going to have really great overall benefits as well, and it's just a nice calming. If you like lavender, they have a chamomile lavender tea that's really delicious. That's not necessarily I'm trying to think. You got me on that though.
I like the blend of Western and Eastern modalities that you use.
Yeah.
And something about roses is supposed to be relaxing too. I had some kind of like rose kind of tea from one of my acupuncturists when I was in Arkansas. And there was like actual roses. I was like, whoa.
Yeah, it's like a rose hip tea. That's also a great thing that you mentioned that, because that's amazing for skin health too, roses.
Oh.
So that's I really like hibiscus tea as well. Now you got me thinking of the flowers. Hibiscus tea is really good. It's great for cholesterol. It's great for just tea in general. It's just a nice relaxing time. Like you just have your tea and you just sit down and you're smelling the aromas of the tea and you're relaxing. So I would say right now, because stress is such a huge thing, like maybe don't go for a highly caffeinated tea if you're looking for some stress reduction. But heating up some water, popping in a tea bag or some loose leaf tea, and just sitting down and enjoying the moment. I think we forget to have gratitude in this time. We're so stressed out, but
Yeah.
we're here, and it's a time that we're like spending more time with our family, and we're connecting with friends virtually. We should have gratitude for that and be happy in craziness.
And I grew up in England, and it's a tradition there. Like, if anything goes wrong, we'll put the kettle on.
Yeah, exactly.
And I love in the Asian cultures how tea is its own ceremony, and it's part of like the culture of life, and it's something beautiful and a moment that you take to enjoy the simple pleasures. And so we are out of time.
Oh wow, wow.
Goodbye. But thank you so much, Christy. And if people want to reach you, we'll leave them a link on for so that they can do that. But they can always reach me to get to you, info at pulsarhealth.com, info at pulsar health.com. And thank you so much. You're so wonderful.
Thank you.
Forward to spending more time with you. Right,
yes, care. Thank you for having me.
Bye-bye.
Bye.